Most people think joint pain is simply worn out cartilage and that the only way forward is chasing stronger pills. After 60, the fuller picture is that joints ache when tissue irritation, muscle deconditioning, and a jumpy nervous system pile on top of normal wear. That's actually hopeful. Quick relief and real repair are different tools, and using both on purpose changes how your knees feel on stairs, how steady your hips feel on curbs, how reliable your shoulders feel when you reach up, and how confident your hands feel with jars and keys. In the next few minutes, you'll learn what calms pain today without stopping you from moving, what truly rebuilds capacity over the next 6 to 12 weeks, how to spot muscle trigger points that pretend to be joint pain, and an at-home way to track whether anything is working. Stay to the end for a 20-second self-check and the most overlooked daily fix that protects knees, hips, shoulders, and hands. We'll stick to what larger studies generally support, what they don't, and exactly when to involve your clinician. If you like calm, plain language health guidance, subscribe and tell me in the comments which joint is bothering you most lately. Knee, hip, shoulder, or hands, so I can tailor future videos to you. We'll count down from 5 to 1, with 1 being the most overlooked. Number 5 is the Rapid Relief Toolkit, the things that can help today while you keep moving. When stiffness rules your mornings, gentle warmth for about 10 minutes, like a warm shower or a heating pad set low, loosens guarded muscles and nudges more blood into the area. Follow that with small, slow circles through a comfortable range. If the area feels puffy, hot, and irritated after a task, a short bout of cool can quiet the spike. Topical anti-inflammatory gels are often effective for knees, hands, and elbows because they act locally with less whole-body exposure than a pill. Regular use of capsaicin cream can also dial down overactive skin nerve messengers after a couple of weeks. A light compression sleeve gives your brain better position feedback so you feel more stable and move more naturally. Combine any of these with 5 to 10 minutes of easy walking and you've signaled, "We're safe, we're moving, turn the volume down." This works because pain is a protective alarm. Irritated tissues release chemicals that sensitize local nerves. Warmth, gentle motion, and light compression change that chemical bath and improve proprioception, your built-in GPS for joints. The more clearly your brain senses where a joint is, the less it needs to guard it with pain. A familiar moment. You stand from a chair and the first step feels sharp, then it softens as you walk. That pattern often means the joint hates surprise load but tolerates a gradual ramp. Warmth, a sleeve, and a slow start turn a difficult morning into a workable one. Use common sense around medicines. If you take blood thinners, have kidney disease, or a history of ulcers, don't add over-the-counter anti-inflammatory pills without clearance. Topical gels may be safer for many people, but still confirm fit. And if a joint becomes acutely hot and very swollen with fever, or you can't bear weight after a twist, that's a same-day call. If pain wakes you nightly for weeks despite gentle care, or swelling lingers more than a couple of days, it's time to loop in a professional. Number 4 is nutrition and supplements. Useful, but not magic, and a quick myth bust. Diet can lower background inflammation, but it behaves like a dimmer switch, not an on-off button. A pattern rich in colorful vegetables and fruits, olive oil, nuts, seeds, beans, whole grains, and regular fatty fish tends to help comfort over 8 to 12 weeks. 2 servings of salmon, sardines, or mackerel weekly supply potent omega-3s. If you don't eat fish, ground flax, chia, and walnuts are still supportive, though less concentrated. Seasoning with turmeric and black pepper may help some people over time. Supplements can interact with medications, so clear them first if you take blood thinners or have gallbladder issues. Protein matters for the structures that actually protect your joints, muscles, and tendons. Spreading protein across the day, often around 1 to 1.25 grams per kilogram of body weight, individualized with your clinician if you have kidney disease, gives your body raw materials to rebuild. Collagen or gelatin powders are often advertised as rebuilding cartilage. Your body does use those amino acids, but it decides where to put them based on what you ask it to do. There's some evidence that 10 to 15 grams of gelatin or collagen with a little vitamin C, taken 30 to 60 minutes before targeted exercise, can nudge collagen production in the work tissues. Without the exercise signal, powders don't know where to go. Here's the myth bust. Bone broth doesn't heal joints fast. It can be soothing and hydrating, and it does provide small amounts of amino acids, but there's no strong evidence it outperforms simply hitting your protein needs and training the specific tissues you want to strengthen. Enjoy it if you like the taste. Don't pin your hopes on it. Another claim you might hear is that an anti-inflammatory diet eliminates the need for medication. Food patterns can reduce the overall volume of pain, yet they rarely replace every other tool. The smartest approach layers strategies so you can move more, which then makes nutrition pay off even more. It's common to try a week of anti-inflammatory meals and feel disappointed when stairs still gripe. Change takes time. Give nutrition 8 to 12 weeks while you work on the next pieces. Use the rapid relief tools so you remain active enough for food to matter. Number 3 is the hidden culprit that often gets missed: muscle trigger points and stiff fascia that pretend to be joint pain. Many sore knees are chasing a front thigh problem. Many cranky hips are being tugged by the side butt muscles. A lot of aching shoulders start with small rotator cuff muscles around the shoulder blade, or a tight front chest tying the shoulder forward. Muscles work best when they can contract and glide. After injuries, long sitting, or guarded movement, small knots form where the muscles on switch get stuck. Those knots can refer pain to a nearby joint, convincing you that cartilage is the villain when it's really a tight muscle yanking on the area. There's a simple way to explore this at home. Stand with your side to a wall, place a tennis ball against the outer third of your thigh, and gently lean until you feel a tender spot that seems to speak to the knee. Breathe and hold a pressure you can tolerate for about a minute. You're waiting for a softening, not hunting pain. Follow with a few slow, controlled sit-to-stands from a high chair to teach the muscle to lengthen and shorten again. For the hip, find the tender area just behind the bony point on the side butt and repeat the same hold and breathe approach. Then practice a gentle bridge on the floor. For the shoulder, find the small muscles at the back of the shoulder blade and the tight spot along the front chest near the armpit. Then do a wall slide or light band row afterward. This works because pressure and slow movement together tell the nervous system, we can glide here. Fresh blood flows in, waste chemicals move out, and the muscle stops yanking on the joint capsule. Over days, you'll notice the sharp first step becomes a stiff but okay first step, then quiet. If you feel tingling traveling below the knee or elbow, or you notice new weakness, pause and get checked to rule out nerve involvement. If a lump doesn't soften over time or grows, that deserves a look too. If this is helpful, tap subscribe so you don't miss the next step we're going to build this week. Number 2 is real repair. Progressive loading that changes how joints feel by changing the tissues around them. Cartilage cushions, but muscles are your shock absorbers and alignment managers. When the quadriceps control the last few degrees of knee straightening, stairs stop feeling like a negotiation. When the glutes steer the thigh so the knee tracks over the second toe instead of collapsing inward, load spreads more evenly across the joint surfaces. Strong calves and feet recycle energy with each step so the knee and hip don't absorb the entire impact. Around the shoulder, A steadier shoulder blade and cuff keep the ball centered in the socket when you reach or lift, which protects the tendons that hate being pinched. Tissues adapt to the signals you give them. 2 or 3 non-consecutive days per week. Choose a few moves and do 2 sets of 8 to 12 slow repetitions, resting a minute between sets. Slow is the secret ingredient. Count 3 seconds down, 2 seconds up. For knees, practice sit to stand from a chair high enough to control the whole movement. For hips, try a hip hinge with a long spine or a side-lying leg lift. For shoulders, do wall slides and light band rows. For hands, squeeze therapy putty and open the fingers against a rubber band. By the final repetitions of each set, the effort should feel like a 6 or 7 out of 10. When it becomes a 4, it's time to make it slightly harder with a thicker band, a lower chair, or a small weight like a book. There are reliable at-home gauges to show you whether this is working. Time how long it takes to stand up and sit back down 5 times with arms crossed. Many older adults feel solid under about 12 seconds. If you're over 15, that becomes your training focus. Retest every 2 weeks. Balance is another stealth protector. Stand near a counter and see if you can hold 10 seconds on one leg, then the other. Improving that small skill changes how your knee handles uneven ground. Body weight and footwear are quiet variables that matter. Each pound can translate to several pounds of force at the knee with every step. No shame here. This is just physics. If weight loss isn't a good target for you, adding muscle changes the forces too. Shoes with even tread and midfoot support help the knee track. If your soles are worn more on the inside edge, consider a supportive replacement. For hands, using a larger handle on tools and pins spreads load and calms an irritated thumb base. It's normal to wonder how to push without poking the bear. Use a simple rule. If the area feels used and a bit achy for less than a day, you're adapting. If sharp pain escalates and lingers into the next day, scale the next session down, fewer reps, a slower tempo, or a higher chair, and build back up gradually. Locking, giving way, or swelling that sticks around for more than 48 hours deserves a conversation with your clinician or a physical therapist to fine-tune loading. Number 1 is the daily fix most people overlook. Circulation minutes paired with pain-smart sleep. Joints don't have a big direct blood supply. They drink from the synovial fluid that shifts in and out as you move. Long stretches of stillness let stiffness chemistry build up. Gentle motion snacks bathe cartilage and tendons, reassure the nervous system, and reduce the number of times the alarm gets triggered. 3 times a day is powerful. After breakfast, after lunch, after dinner, stand and do 20 to 30 slow heel raises at the counter, 10 easy sit-to-stands to a high chair, and a minute of hallway marching. For hands, open and close your fingers against a rubber band. Bend and straighten the fingers slowly and roll the wrists. If stairs are unfriendly, walk flat for 3 minutes. If weather is rough, pace your home or stand and shift weight side to side. Sleep turns pain volume down at the brain level. When you're short on sleep, your filters for pain are weaker and normal sensations feel louder. A steady sleep window of about 7.5 to 9 hours helps your brain reinterpret signals from sore tissues. Keep caffeine earlier, dim lights an hour before bed, and try a tiny pre-sleep routine. Gentle ankle, knee, and hip motions, a relaxed shoulder pendulum, and 10 slow nasal breaths. Many people notice fewer night spikes and easier first steps in the morning when this becomes habit. Everything we've covered fits neatly into a compact plan you can start today without rearranging your life. First, keep the rapid relief tools ready so you can stay active on cranky days. Warmth quiets guarding. A brief cool tamps down a hot flare. A light sleeve gives confidence. And a short walk keeps the system moving. Second, twice weekly. Do a slow tempo strength session for 20 to 25 minutes. Pick 4 movements: something to squat or stand, something to hinge, something to push, something to pull, and progress in tiny steps. Third, eat in a way that supports tissues over months. Protein at each meal, colorful plants, and omega-3s from fish twice a week. Adjusting protein and supplements with your clinician if you have kidney disease or take interacting medications. If you enjoy a collagen or gelatin supplement, pair 10 to 15 grams with a vitamin C-rich food 30 to 60 minutes before your strength session, so the building blocks are delivered when the tissues are listening. Supplements deserve a clear frame so you can set expectations. Glucosamine and chondroitin help some people with knee osteoarthritis and do very little for others. If you try them, give it a fair 3-month trial and discontinue if you don't notice meaningful improvement. Curcumin may help knee discomfort in some trials, but can interact with blood thinners. Magnesium can ease muscle cramps and improve sleep for some, which indirectly helps pain. Discuss dosage and kidney status first. None of these replaces the core work of movement and loading, but they can play a supporting role for the right person. Pacing your week often prevents flares better than any cream. Instead of saving every task for one good day and then crashing, break chores into smaller chunks with short breathers in between. Use tools that reduce strain: a jar opener with a wide grip, knives with cushioned handles, a long-handled reacher for lower cabinets, a rolling cart for laundry. When standing from a chair, scoot to the edge, place your feet under your knees, lean your chest forward slightly, and push the floor away evenly with both feet. When stepping off a curb, imagine your knee tracking over your second toe rather than drifting inward. When lifting, keep the load close to your body and exhale. That helps your rib cage stay soft so the shoulder blade can glide. Hand comfort changes quickly with a little warmth and gentleness. A warm water soak or warm compress for 10 minutes before breakfast makes the first grip of the day friendlier. Use 2 hands for heavier pans. Slide objects along the counter instead of lifting. Alternate pinch and power grips so the same small joints don't take every load. A soft thumb brace during heavier tasks can calm irritation while you build support with simple thumb and forearm exercises across the week. It helps to know when to bring your clinician into the loop. Persistent joint warmth, redness, or swelling that doesn't settle within a couple of days, locking or catching in a joint, unexplained weight loss, fever, night sweats, or hand stiffness with puffy joints that last more than 30 minutes most mornings are good reasons to ask about inflammatory causes. If pills don't agree with you, ask whether a topical option fits and whether physical therapy could tailor your loading plan. Imaging like MRI is usually saved for trauma, persistent mechanical symptoms, or when a solid trial of conservative care hasn't moved the needle. You don't need a scan just to look when the plan would be the same. You might be wondering how to measure progress without overthinking it. 2 easy yardsticks tell the story. The 5 times sit to stand test is 1. Time yourself today, repeat in 2 weeks, and again at a month. If your number drops and you feel steadier, you're building capacity. Single leg balance is the other, 10 seconds per side near a counter. When that improves, your tiny stabilizers are waking up, and stairs and uneven sidewalks feel less risky. Layer in a simple journal note: what you did, how it felt that day, and how it felt the next morning, and you'll see patterns that guide your next tiny step. Here's the promised 20-second self-check. Stand near a counter and shift weight to your right leg. Lightly hold the counter if needed. Keep your knee pointing over your second toe as you gently send your hips back an inch. Then return to upright. Do 2 or 3 slow reps, then switch sides. If one knee drifts inward or you wobble hard, Bookmark that side for daily practice with fingertip support until you can balance for 10 seconds and do 5 smooth mini squats without the drift. This little test reveals hip control. One of the biggest differences between stairs feel risky and stairs feel routine. Everything you've heard can start small today. Keep a few rapid relief options on hand so you can keep moving on less cooperative days. Add 3 short circulation minutes spaced through the day to feed your joints and reassure your nervous system. Pick 2 days a week for slow, controlled strength work and progress a tiny bit every week. Choose meals that quietly lower background inflammation over months, not days. Explore and soften trigger points around cranky joints, and then move through range so muscles relearn to glide. Protect sleep with a short wind-down routine and steady wake times so your pain filters are stronger tomorrow. In 2 weeks, retest your chair stand time and balance. In 4 to 6, notice how errands and steps feel different. I'll link plain language sources and simple exercise guides in the description. You deserve joints that feel trustworthy, not temperamental. Consistency beats intensity in this season of life. 3 ordinary days repeated will carry you further than 1 heroic weekend. Celebrate the small wins, a quieter first step out of bed, a smoother curb, a jar you open without bargaining with your hands. Those are proof that biology is listening and adapting to what you practice. Tell me in the comments what you'll try first: circulation minutes, the slow tempo strength session, or the trigger point work, and which joint you want help with next. If this brought clarity and calm to your plan, tap like, subscribe, and share it with a friend over 60 who's been quietly struggling. Your story will encourage someone else. I'll see you in the next episode where we take the next practical step together.